In this video we will talk about sickle cell anemia treatment. How is sickle cell anemia treated? Don't forget to like, share and subscribe to our YouTube channel to be notified when we upload new videos daily. What is sickle cell anemia? Sickle cell anemia is a lifelong, chronic disease that affects over 72,000 people in the United States. In most cases, there are not continual symptoms but periodic painful attacks. It can also weaken the immune system and cause other complications such as strokes. People with sickle cell anemia also typically have a shortened lifespan. There is no cure for this disease but treatment options are available. Causes of sickle cell anemia. Sickle cell anemia is caused by a mutation in the gene that tells your body to make the iron-rich compound that makes blood red and enables red blood cells to carry oxygen from your lungs throughout your body, hemoglobin. In sickle cell anemia, the abnormal hemoglobin causes red blood cells to become rigid, sticky and misshapen. 10 causes of low hematocrit blood levels. A person who has a low hematocrit is referred to as being anemic. There are many reasons for anemia. Some of the more common reasons are loss of blood, traumatic injury, surgery, bleeding, colon cancer, nutritional deficiency, iron, vitamin B12, folate, bone marrow problems, replacement of bone marrow by cancer, suppression by chemotherapy drugs, kidney failure, abnormal hemoglobin, sickle cell anemia. Both mother and father must pass the defective form of the gene for a child to be affected. If only one parent passes the sickle cell gene to the child, that child will have the sickle cell trait. With one normal hemoglobin gene and one defective form of the gene, people with the sickle cell trait make both normal hemoglobin and sickle cell hemoglobin. Their blood might contain some sickle cells, but they generally don't have symptoms. They're carriers of the disease, however, which means they can pass the gene to their children. It is essential to seek a consultation with a medical profession if symptoms of this disease are present. Even if a person is not currently experiencing pain or symptoms, continual treatment is necessary. Treatment will help reduce the frequency of episodes and delay the time in between them. Children with this disease are often hospitalized and given intravenous antibiotics. These help prevent bacterial infections commonly seen in children. They also generally continue to take oral antibiotics until they are 5 years old. The major features and symptoms of sickle cell anemia include fatigue and anemia, pain crises, dactylitis, swelling and inflammation of the hands and/or feet, and arthritis. Bacterial infections, sudden pooling of blood in the spleen and liver congestion, lung and heart injury, leg ulcers, aseptic necrosis and bone infarcts, death of portions of bone, eye damage. Advances in science are producing newer drugs to help combat symptoms, but the drug hydroxyurea is the most commonly prescribed. There have been indications that this drug may increase the risk of acquiring leukemia, but no concrete evidence to this effect is yet to be shown. There are also common side effects to this drug such as painful urination and back pain. Treatment for pain is necessary for people with this disease. Those experiencing mild, short-lived episodes may be prescribed a variety of non-narcotic pain medications. However, acute pain may require use of narcotic drugs to help control it. These are valuable in lessening symptoms and leading a more comfortable life, but they can be addictive. It is also important to maintain health with proper diet and exercise. In addition to a well-balanced diet, a regular exercise routine should be implemented. Relaxation techniques such as meditation, yoga, breathing exercises are helpful to reduce stress and can also be used as pain relief. Ensure adequate bed rest and a good night's sleep. Blood transfusions are often implemented to increase the quantity of normal red blood cells. These treatments can be performed regularly with low risk. In more extreme cases, a bone marrow transplant may be recommended. However, this is rarely used due to the high risk and low probability of finding a suitable donor. Continual treatment and monitoring of this disease is essential in keeping complications at bay. Although this disease generally lowers life expectancy, with proper treatment most people suffering from this disease can lead full lives. Over the past 30 years, there has been an increase in the life expectancy for people suffering from sickle cell anemia. When to see a doctor? Sickle cell anemia is usually diagnosed in infancy through newborn screening programs. If you or your child develops any of the following problems, see your doctor right away or seek emergency medical care. Fever. People with sickle cell anemia have an increased risk of serious infection, and fever can be the first sign of an infection. Unexplained episodes of severe pain, such as pain in the abdomen, chest, bones or joints. Swelling in the hands or feet. Abdominal swelling, especially if the area is tender to the touch. Pale skin or nail beds. Yellow tint to the skin or whites of the eyes. Signs or symptoms of stroke. If you notice one-sided paralysis or weakness in the face, arms or legs, confusion, trouble walking or talking, sudden vision changes or unexplained numbness, or a severe headache, call 911 or your local emergency number right away. Warning: none of the information on our videos is a substitute for a diagnosis and treatment by your health professional.